Yes,
Hello?
yes po, ma'am.
Okay.
Ba't
Sige.
po ganito?
Para mas mag-guide kayo ha sa assessment from danger sign, from demographic data, danger sign, main symptoms, nutritional status and anemia, immunization, and other problem. Can you still follow?
Yes, ma'am.
Okay. Then identify treatment. After classification, then identify treatment. So nakalagay dito, determine if urgent referral is needed. So kasama yun sa treatment. Treatment as well as sa treatment, nandoon yung kung sino yung mga classification na kailangan i-refer. So i-identify ninyo yon. Identify also treatment needed or significant treatment. Lahat ng nakastipulate doon na treatment per classification, i-identify ninyo kung ano yung applicable, kung ano yung i-manage ninyo, kung ano yung i-apply ninyo. For example, for pneumonia, wala naman siyang wheezing, pero meron siyang ubo, tapos classified as pneumonia because meron siyang chest indrawing and fast breathing, pero wala siyang wheezing. Pero merong treatment doon sa pneumonia if wheezing, apply bronchodilator. So there's no need for you to administer bronchodilator, so wag mo na siyang isulat as treatment kasi hindi mo naman siya mamamanage. Tapos generally also, lahat ng may mga classification na may urgent referral, no need to apply yung other treatment na mga hindi severe ang classification. Kasi nga, kailangan ng immediate referral. Can you follow? Naintindihan?
Yes po, ma'am. Yes po, ma'am.
So nakalagay dyan, for patients who need urgent referral, you identify the urgent pre-referral treatment. So kasama din sa i-identify mo yung mga pre-referral treatment, yung mga kumbaga first aid or mga management before referring the child or on the way to the hospital, ano yung i-advise mo sa mother? So pwedeng magbigay ka ng sugar water, i-advise mo ang mother to continue breastfeeding, i-advise mo ang mother to warm the child. So, i-cover yung child ng warm blanket or any blanket. Diba? Yan yung mga pre-referral treatment. Or, kunyari, may convulsion. So, wag mo naman i-refer nagka-convulsion siya sa ambulance or nagka-convulsion siya sa, sa vehicle during transportation. I-stabilize mo muna yung bata bago mo siya on the way to the hospital. Yan yung mga pre-referral treatment. Okay. Kasama din dyan yung i-explain mo ang need for referral to the mother. At saka lahat ng batang for referral, kailangan may attachment ka na referral note. So ito yung i-present ko sa inyo last meeting, di ba? Okay, yan yung content ng referral note. May mga institution again na meron silang standardized referral note. All you have to do is to fill up yung referral note. Kung wala naman, ito yung basic content, important content ng referral note. Of course, the date, the time of referral, yung age ng bata, yung demographic data ng bata. Bakit mo siya i-refer? Yung reason bakit mo siya i-refer? Diba? Kung ano yung mga management na binigay mo before referring the child. Tapos, sino ang nag-refer? At saka anong institution? To the point, you can also put your contact number para in case meron silang question, pwede ka nilang tawagan. Can you still follow?
Yes, ma'am.
Yes, ma'am.
So, ito yung sample ng ating referral note. So, kung walang referral note, walang referral form ang isang institution, kumuha kayo ng clean paper naman. So, standard size, pwedeng 1/4, pwedeng 1/2. Basta ganito yung presentation ng referral note. Okay, pag student nurse can also refer. You just have to affix your name and signature. You let your CI sign as well as the staff kung saan kayo na belong. Okay? Can you still follow?
Yes, ma'am.
Okay. So, itong treat young infant, ito yung second client kasi natin, the 0 to 2 months. So, skip muna natin yan kasi hindi pa tayo nakadiscuss ng sick young infant. Okay. After treatment, di ba, we have this counsel the mother. Ang counsel the mother content recommendations on food, care for development, fluids, and when to return. And also included dito yung mga treatment na ika-counsel mo, yung i-advise mo sa mother. Particularly yung mga green row at saka yellow row. Nakuha?
Yes, ma'am.
Okay. You also have this follow-up care. Kung mapansin niyo sa mga classification, sa mga treatment per classification, meron doong advice when to return immediately at saka follow-up number of days. Okay? So, ang cue lang dito, the earliest day to come back, kung yun yung i-advise mo kung kailan sila babalik. So, merong mga recording form na merong nakalagay sa taas, follow-up in 3 days, follow-up in 5 days, follow-up in 14 days, follow-up in 21 days. So, again, ang cue mo, the earliest day to come back. So, anong earliest doon? 3 days. Diba? Okay. Kung urgent man yan ha, do not chat me. Hindi ko yung mabasa. You raise your hand. Mas makita ko yun. Okay. Naintindihan so far?
Yes po,
Hello.
ma'am.
Okay. Ito na yung mga content ng treatment natin. Pero mas madali kasi based sa experience ko in teaching students, mas madali kung doon tayo magdi-discuss sa booklet. Pero ito mga summary ito ng treatment. Kumbaga, gi-compile ko ba? Okay, pwede na lang siguro mag-take ng screenshot or mamaya din kasi ilalagay ko yung page kung saan nyo makikita yung treatment. So far, may question ba kayo para doon na tayo sa booklet? Ha, yan lang yan, oh. Gi-classify ko lang yan, mga treatment na yan. Ayan, pwede ko din yan siya i-present sa inyo later pag natapos natin discuss yung content ng booklet, particularly sa treatment. Okay ba? Hello?
Yes po, ma'am.
Yes po, ma'am.
Yes po, ma'am.
Move forward na ako, ha? Okay, end po ito. Dito tayo sa booklet ninyo. No. Yan. Kita nyo na yan? Hello?
Yes po,
Yes
ma'am.
po,
Yes
ma'am.
po, ma'am.
So, unahin natin ito. Dali, hakunin ko yung code dito. Ng mga pages. Gikuan ko kasi siya. Kayo din, pwede sa booklet ninyo, you just use pencil, ilagay nyo na automatic yung page para hindi na kayo maghanap. Diretso na kayo doon sa page kung saan talaga siya makikita. Okay. Isa tayo dito sa danger signs. Ayan. Ang significant treatment sa ating danger signs, very severe disease. So, present any of the danger signs. So, you classify it as very severe disease. Give diazepam if convulsing now. Ha? If convulsing now. Hindi pwede history of convulsion, bibigyan mo ng diazepam. So, again, may parameters tayo, may guidelines tayo. How to classify convulsing now. Less than 6 months, ulitin ko lang, any episode, convulsing now yan. 6 months and above, kailangan 2 episodes in 15 minutes interval. So in giving diazepam, you turn your booklet to page 17. Tingnan natin yung 17. Okay. Ay, di ko sa ito kabaluan ng tab-tab. Dali ha. Dali. Okay. Dali lang talaga. Kaya di good teki inyong CI. Hina pag yung perception and coordination. Okay, yan. Pero good tong ginatab lang, no? Mas madali. Hindi man ako marunong. Kita na ba yan? Yan na lang. Punta kayo sa page 17 dito. Hello? Klaro pa ba yan?
Yes
Yes,
po.
ma'am.
Hello?
Ma'am.
Opo.
Hello?
Yes po, ma'am.
Ay. Hello, hello. Okay na ba? Sorry,
Yes
nalobat
po,
ako.
ma'am.
Okay na po, ma'am.
Okay,
Okay.
ayan na, ayan na. Dali ha. Okay, balik muna tayo dito. Ayan. Ito yung mga treatment ng inyong severe classification, particularly sa danger sign. Give diazepam if convulsing now. Quickly complete the assessment. So, kahit na sabihin mong needs referral yung bata, kailangan mo pa rin tapusin yung assessment. Kaya as much as possible, tinuturo talaga namin sa students na mabilis ang pag-conduct ng IMCI, lalo na yung may mga classification na P. Okay, give any pre-referral treatment immediately. Treat to prevent low blood sugar. Keep the child warm and refer urgently. So basahin ko lang itong notation na nakalagay dito. A child with any general danger signs needs urgent attention. Complete the assessment and any pre-referral treatment immediately so referral is not delayed. So naka-emphasize talaga yan na kahit na may urgent referral na kailangan pa rin tapusin yung IMCI. For giving diazepam, you can check the dosage of diazepam on page 17. Okay, punta tayo sa page 17. You may write page 17. Page 17, ayan yung dosage ng inyong diazepam. Okay. Ang diazepam natin, binibigay siya anal. Okay? Turn the child to his or her side and clear the airway. Avoid putting things in the mouth. Diba, meron pa rin practice noon na inalagyan natin ng kutsara yung bibig kasi para ma-avoid yung mabite nila ang kanilang tongue. Hindi na yun practice. Actually, hindi talaga yan gina-practice medically. Kasi ang gina-avoid lang natin na hindi sila ma-aspirate. Kaya gina-turn natin sila into sides tapos as much as possible, we keep the patient safe. Na during convulsion, walang walang matumba sa kanila or matama sa kanila or matama ang kanilang ulo. Okay? We give 0.5 milligrams per kilograms of diazepam injection solution per rectum. So yung syringe, tanggalan mo siya ng needle, tapos yun ang gagamitin natin. Yun yung gina-insert natin anally. So with the following dosage ng ating diazepam. Okay, ayan. Check for low blood sugar, then treat or prevent. Give oxygen and refer. If convulsion have not stopped after 10 minutes, repeat the diazepam dose. Dyan, age or weight ng bata. Pero always, may bearing ang weight over the age. Okay? Naintindihan ninyo? So, dalawa lang yung classification niya, age or weight. Pero always, kunyari, present naman, alam nyo yung age ng bata, plus meron kayong weight, mas may bearing pa rin yung weight. Kahit na sabihin mo 6 months, pero ang weight ng bata is 10 kilograms, itong 10 kilograms na dosage ang ipa-follow ninyo. Naintindihan ba?
Yes, ma'am.
Okay. So, ayan yung mga dosage ng ating diazepam. So, ito lang, hindi lahat ng health center merong diazepam. Pero standard kasi na practice ng IMCI, since i-introduce ang IMCI sa mga health center, pinapa-prepare din sila ng mga medicines under IMCI. So, meron talaga sila mga diazepam. So, nurses can give diazepam under IMCI protocol. So kung meron tayong na-identify sa health center na nagka-convulsion na hindi naman neurologically related, we can manage it with diazepam. Particularly, yung may mga convulsion because of high fever. Naintindihan ba
Yes po.
ng all? Okay, so yan yung ipa-follow natin na dosage. So with the make use of your syringe, ideally ang syringe na ginagamit namin dito is the tuberculin. Kasi masyadong malaki yung mga 3cc or 2.5cc syringe natin. Total 0.5 ml, ang pinakamarami is 2 ml. So kaya pa rin siya ng tuberculin syringe. Maka-identify ba kayo ng mga syringes natin? Ha? Terumo is the brand, pero yung mga type of syringes, according yan siya sa dosage. So, merong tuberculin, merong 2.5 cc, 3 cc, 5 cc, 10, at saka yung parang asepto syringe na ubod ng laki. Okay? Okay. Another treatment is your treat to prevent low blood sugar. So makita nyo naman yung specification ng treatment for low blood sugar sa page 18. So nandito yan siya. Ayan. Treat the child to prevent low blood sugar. So if the child is able to breastfeed, ask the mother to breastfeed the child. Kasi kaya lang naman mababa ang sugar niya kasi nga wala nang sugar yung katawan niya. So pwedeng replacement yung breast milk. 'Di ba ang ibang nga diabetic, pag nag-hypo sila, ginapainom ng Coke para mag-increase yung sugar. Okay? Sa IMCI naman, we can ask the mother to breastfeed the child or to feed the child. If the child is not able to breastfeed but is able to swallow, give express breast milk or breast milk substitute. So yung mga batang dehydrated na hindi nila kaya maglulon ng kanilang breast milk, pwede natin hindi kaya mag-suck, pwede tayo i-request natin yung mother na mag-express ng kanyang breast milk. If neither of this is available, give sugar water. So for short, ito yung replacement natin sa breast milk or formula milk. Give 30 to 50 ml of milk or sugar water before departure kasi nga ito yung pre-departure natin na management. If the child is not able to swallow, we give 50 ml of milk or sugar water by nasogastric tube. Are you familiar with NGT tube? Diba nurses
Yes,
can
po,
use
ma'am.
NGT
Yes
tube.
po.
Okay, yun lang sa mga private institution, clerk ang ginapa-insert nila. Pero sa ate, actually, in general, pwede mag-insert talaga ang mga nurses ng NGT tube. Okay, if nasogastric tube is available, you give 1 teaspoon of sugar, moisten with 1 to 2 drops of water sublingually, and repeat doses every 20 minutes to prevent relapse. Okay. How to make sugar water? So you dissolve 4 level teaspoon of sugar equivalent to 20 grams in a 200 ml cup of clean water. So ito yung sugar water natin to hydrate the child to prevent hypoglycemia. Okay, nakuha? So always daw to lumalabas sa board exam lalo na sa community health nursing na area. Yung how to make sugar water. So ito yung paggawa natin ng sugar water. Can you still follow?
Yes, ma'am.
Okay. Question so far? Naintindihan pa ba? So yan yung mga treatment under very severe disease. Okay. Balik tayo dito sa ating next item. So mag-umpisa tayo sa main symptoms ng pneumonia. Ayan. So sa pneumonia, sa cough or colds, ang batang may ubo or difficulty of breathing, ang possible classification niya, ulit-ulit ko na itong ginasabi. Pero pagdating sa quiz, wala lang yan po nakuha. Diba? Na-check ko na pala yung mga quizzes ninyo. Pag face-to-face ko na lang siya ibalik. Okay? So, ito yung mga possible classification. Severe pneumonia, cough and colds. So pag may danger sign siya plus may ubo ang bata, you check kung wala pa siyang stridor. So kung may stridor naman siya, wala siyang danger sign, still you classify it as severe pneumonia or very severe disease. Okay? Ang batang may ubo, walang stridor pero may chest and drawing or may fast breathing, you classify it as pneumonia. Ang batang may ubo pero sa further assessment mo walang significant sign, iubo lang talaga siya. So, cough or colds. Okay. Balik tayo dito sa severe pneumonia or very severe disease. Ang treatment, sabi ng IMCI, we give first dose of an appropriate antibiotic. So, to check for what antibiotic to give, you can check to page 12. Okay. Sa page 12, ano yung page 12 natin? Sobrahan. Ayan. Give an appropriate oral antibiotic. So naka-classify siya actually first line and second line. For pneumonia, acute ear infection, at saka kung napansin nyo na sa mga booklet ninyo, ang ibang classification, merong mga naka-treatment dyan na appropriate antibiotic. So ito yung known antibiotic na binibigay natin sa general condition. Okay? So first line antibiotics, oral amoxicillin. So ito yung dosage. Again, naka-classify according to age or weight. So always may bearing ang weight over the age. So kung mapansin niyo dyan, drops and suspension ang preparation. So ang strength ng ating drops is 100 milligrams per ml. Ang suspension naman is 250 milligrams per 5 ml. Usually, ang drops preparation na may strength na 100 milligrams per ml, binibigay yan sa mga batang less than 12 months or specifically 6 months. Okay, so all you have to do is to follow kung saan siya naka-align. So kung for 12 months up to 3 years old na with this weight na 10 to 14 kilograms, dito na kayo sa suspension. So ang ilalagay ninyo sa treatment, give amoxicillin 250 milligrams per 5 ml, 5 ml 2 times daily for 5 days. Para pag-counsel ninyo sa mother, doon na lang kayo titingin sa recording form. So wag nyo na isulat na give appropriate antibiotic. Specify na kaagad kung ano yung antibiotic na ibibigay ninyo. Can you follow? Okay, may mga notations dyan ha. Amoxicillin is the recommended first line of drug choice in the treatment of pneumonia due to its efficacy and increasing high resistance to cotrimoxazole. Dati-rate, mga siguro 12 years ago, ang first line antibiotic natin is cotrimoxazole. So as the time passed by, na-discover na mas maraming adverse effects ang cotrimoxazole. Kaya na-change siya. Pero binibigay pa rin yung cotrimoxazole. Okay, halos lahat naman ng mga medicine natin, meron yan siya mga side effects and adverse effects. So, ang ginatingnan lang talaga natin dyan, ma-outweigh nung effect ng isang gamot yung mga adverse effect niya. At saka manageable naman yung mga adverse effect at saka side effects. Okay, nakuha yan. Okay. Ayan. So, ang ating antibiotic, particularly the first line antibiotic, which is your amoxicillin, binibigay sa mga batang classified with pneumonia, acute ear infection, even doon sa mga malnourished children. Okay? So makita ninyo yan later na meron talaga merong mga classification doon na nakalagay give appropriate antibiotic. So kung ano yung antibiotic na yon, ito yon, amoxicillin. Nakuha? Okay, another treatment is your page 12 yan, is your, if merong wheezing ang batang may ubo tapos may wheezing, you refer to page 13 for the wheezing specification. So page 13, ayan. Kita yan? Give inhaled salbutamol for wheezing. So, naka-specify lang dyan kung anong gagamitin. Nakakita na ba kayo ng nebulizer? Ha? Lahat ba nakakita na ng nebulizer? Miss Vasquez. Mr. Vasquez ba ito? Miss Vasquez. Where is Vasquez? Vasquez? Where are you? Wala. Konato.
2S po ata yan. Ma'am.
Ay, sila ba?
Wala kaming classmate
Wala
na kanata,
dito,
ma'am.
Sila bakit ito ang gipang tuwigan? Sa 2S pala sila. Sandali. Okay. Miss Espino, nakakita ka na ba ng koan? Ng ano tawag nito? Ready pa naman to for recitation. 2S din eh.
Wala pa ako nakakita, ma'am.
Okay. Anybody? Sino yung
Ako po,
nakakita ng
ma'am.
nebulizer?
Opo,
Me
ma'am.
po, ma'am. Me po, ma'am.
Yan, Lemmy. Ayan, Martinez. Okay. Yung nebulizer natin na merong machine, tapos meron kang i-attach na cord. Okay. Tapos ginalagyan natin ito ng nebule. So, ang mga nebule na ginalagay natin, bronchodilator nebule yun. Yung container ng medicine, yung bronchodilator, ang tawag doon is nebule. So, meron mga preparation na pure nebule, pure salbutamol ang ilalagay mo. Example yan ng nebule to manage, example yan ng bronchodilator. Ilagay mo ang nebule. Meron ding iba na mix it with distilled water. Ayaw nila ng puro, lalo na sa mga bata. Okay? So ito ang concept ng ating nebulization or ng ating bronchodilator. So nakalagay dito mga spacer. Ito mga spacer kasi, ito yung mask lang ito, yung para bang to directly inhale yung bronchodilator natin, ginagamitan nila ng spacer. Since ngayon, meron naman tayong nebulization, yun na yung ginagamit natin to deliver the bronchodilator. Nakuha? Hello?
Yes po, ma'am.
Yes
So,
po,
hindi ko
ma'am.
na lang siya basahin kung ano itong mga spacer, ha? Basta ang concept nitong ng ating giving of bronchodilator is through nebulization. Okay? So, yung nebulization natin, merong nakamask, merong pwede mo tanggalin yung mask, tapos kabitan mo nung ginadikit na ipasok sa bibig. So, andyan pa rin yung concept. Ang concept nun, mapasok sa baga na mag-dilate yung mga bronchioles para hindi mahirapan maghina. Okay. So, i-specify ko lang, merong mga situation na first take ng RR is fast breathing sila. Tapos na-assess mo din na may wheezing yung bata. So, pag may wheezing ang bata plus fast breathing, you manage wheezing first. So, you apply bronchodilator. Then, you take the RR again. Kung despite na nag-bronchodilator ka or nag-nebulize ka sa bata, fast breathing pa rin talaga siya, pneumonia na yung classification niya. Kasi meron ding iba na after nebulization, bumaba na yung RR niya. So, hindi sila pneumonia or walang pneumonia yung bata. Nakuha ba? Hello?
Yes, ma'am.
Yes po, ma'am.
Another
Yes po, ma'am.
management is to soothe the throat. To check for the specification of soothe the throat. Nakita ninyo sa booklet ninyo, soothe the throat. Okay, turn your booklet to page 15. So, andito yan siya. Yan. Ito yung specification ng soothe the throat. Soothe the throat, relieve the cough with safe remedy. Ang mga safe remedies natin na i-recommend, breast milk for a breastfed infant or continue feeding in general, increase fluid intake, particularly doon sa 6 months and above, kasi yung mga 6 months below natin, naka-exclusive breastfeeding yon. Pag sinabi mong exclusive breastfeeding, dapat wala silang intake other than breast milk. Can you follow?
Yes po, ma'am.
Meron din tayong giving calamansi juice. So, itong mga calamansi juice natin, ito yung, or particularly yung SLK natin, the Sampalok Luya Calamansi. So, kung nakapagtanong na kayo sa mga higher years, kung anong mangyayari sa duty ng IMCI, isa ito sa activity. Ang gagawa kayo or magpe-prepare kayo ng herbal plants or herbal medicine. Okay? Isa sa herbal medicine na acknowledged ng DOH is our SLK, the Sampalok Luya Calamansi. Pero sa IMCI, calamansi lang yan. Pero pwede mo ibigay yung combination ng sampalok, ginger, at saka calamansi. Okay. Ano naman yung harmful remedies to discourage? Okay, we do not give cough syrup or mucolytic. This is under IMCI, ha? Again. Ha? Kasi merong mga batang ginaubo, binibigyan sila ng salbutamol, binibigyan sila ng carbocysteine. Yan yung mga mucolytics. Diba? Pero under IMCI, ang harmful remedies, giving of cough syrups and mucolytics. And we also discourage giving nasal decongestant like phenylpropanolamine. Nakuha ninyo? Okay, pero doctors can recommend this one. But we are discouraged to give the following under IMCI protocol. Okay, so pag tinanong kayo, ano mga safe remedies to recommend under IMCI in soothing the throat and to relieve the cough or a safe remedy? Ito yung mga sagot. Breast milk for breastfed infant, increase fluid intake, give calamansi juice. Okay? Tapos ang harmful remedies naman, we do not give cough syrup or mucolytics, give nasal decongestants like your phenylpropanolamine. Ito yung mga disodrin, mga ano ba bang mga phenylpropanolamine, etc. na mga brand. Can you follow?
Yes, ma'am.
Okay. So, okay na yan. Sa cough and cold naman, ang treatment lang natin doon is to relieve the cough, soothing the throat in relieving the cough. So, balik tayo dito, ha? Can you still follow, guys? Yung mga
Yes,
significant
ma'am.
treatment lang ang ipag-discuss ko sa inyo. Okay. Ayan. Ayan. Give oral amoxicillin. Our first line antibiotic is our amoxicillin. If wheezing, you nebulize the child using the bronchodilator. If chest enrolling in HIV, wala man tayong HIV, we don't handle HIV patient. Soothe the throat and relieve the cough. Yan yung sabi ko sa inyo, makikita ninyo sa page 15. If coughing more than 14 days or recurrent wheezing, refer possible TB or asthma assessment. Kasi ito yung possible, ito yung mga signs ng mga batang may TB. Pag ang cough nila 2 weeks or more, gina-screen talaga sila na hindi yan tuberculosis. Okay, advise mother when to return immediately. Ang advise mother when to return immediately ninyo is makikita ninyo sa page 40. Page 40. Singit ko na, ha. Yan. When to return immediately. Halos lahat ng mga classification nakalagay dyan yung when to return immediately. Advise mother when to return immediately if the child has any of these signs. Aside dito sa mga number of days na pabalikin mo sila, you need to emphasize this one. Yung mga batang sick child, yung any sick child, pag meron mag-develop sila sa not able to drink or breastfeed, become sicker and develops a fever, ipabalik mo sila kaagad, wala pang 3 araw, wala pang 5 araw, wala pang 14 days, wala pang 30 days. Can you follow? Naintindihan
Yes po,
niyo?
ma'am.
Opo.
Yes,
Tell the
ma'am.
mother ito, ha, nakalagay dyan na treatment, when to return immediately. So pag ang batang may sakit pero walang danger sign, i-advise natin to, ma'am. Wala pang 3 araw pag ang baby mo napansin mo na hindi na nagadede, hindi na kumakain, tapos luya na kaayos siya, tapos gikalintura siya, wala siya gikalintura karon. Tapos nag-develop of fever, ibalik mo na siya wala pang 3 days. Okay. Ang assessment mo na may ubo, pero wala silang fast breathing, wala silang difficulty in breathing, i-emphasize mo rin yan. Ma'am, wala pang 3 days, pero pag nakita mo si baby na nahihirapan na maghinga, mabilis na yung kanyang paghinga, ibalik mo na siya sa health center or sa hospital. Okay. For diarrhea naman, pag nagkakalibanga siya, wala siyang dehydration, pero kinakalibanga siya. Pero pag na-observe mo na meron ng dugo ang kanyang poop, tapos hindi na masyado siya nagadede again, ibalik mo na siya, wala pang 3 days, wala pang 5 days, wala pang etc. Can you follow?
Yes, ma'am.
Yan yung when to return immediately. Okay. Plus, isusulat mo din itong mga advice when to come back. So, for pneumonia, for pneumonia, follow up in 3 days. For cough or colds, follow up in 5 days. Nakuha?
Yes po.
Okay, basahin lang natin ito. Dali, ha? 2M man pala ito. Okay, volunteer. Sino pa yung hindi naka-recite? Sino pa yung hindi naka-recite? Please, papasa ko lang naman. Para meron na kayong recitation grade. Raise your hand, please. 2S kasi na-prepare ko, hindi 2M. Ito sila in Cabo, 2S ito, hindi ito sila 2M.
Opo, ma'am.
Yes, ma'am.
Okay. Walang mag-volunteer. Sino pa yung hindi na-lista na naka-recite? Automatic na ba yung 100? So, kung hindi kayo naka-recite, wala kayong 100. Sa inyong class standing. Cabrera, naka-recite ka na ba?
Wala pa, ma'am.
Okay. Can you please read this one, Mr. Cabrera? Everything. Ito lahat.
If referral is not possible, manage the child as described in the pneumonia section of the National Referral Guidelines or as in WHO Packet Book for Hospital Care for Children. Oral amoxicillin for 3 days could be used in patients with fast breathing but no chest indrawing in low HIV settings. In settings where inhaled bronchodilator is not available, oral salbutamol may be tried but not recommended for treatment of severe acute wheeze.
Itong mga naka-highlight dito, ito yung mga specification. So, if referral is not possible, we manage the child as described in the pneumonia section of the National Referral Guidelines or in WHO Packet Book for Hospital Care for Children. So, ito ang hindi ko na-prepare ngayon. So, ihahabol ko lang yung content dito. Oral amoxicillin is also another specification in giving oral amoxicillin. For 3 days could be used in patients with fast breathing but not chest indrawing. Okay? In low HIV setting. So, hindi naman tayo nag-a-assess ng HIV but in case, nakalagay dito yung specification doon sa mga HIV patient natin na merong fast breathing or chest indrawing. In settings where inhaled bronchodilator is not available, yung mga nebule natin na bronchodilator, we can give oral salbutamol to manage the wheezing. Nakuha?
Yes po,
Naintindihan ba
ma'am.
ba so far? Okay.
Opo.
So, walang question sa cough. Move na tayo sa diarrhea. So, naintindihan na yung assessment, signs, classification ng mga batang may ubo plus sa kanilang treatment. Nakuha ba?
Opo, ma'am.
Sige, dito tayo ngayon sa diarrhea. So sa diarrhea again, as a review, we are classifying the degree of dehydration as well as the type of diarrhea. Automatic acute diarrhea, gina-classify natin ang degree of dehydration pag less than 14 days ang kanilang diarrhea. Pag 14 days or more, classified as persistent diarrhea. Ang diarrhea with blood in the stool, classified as dysentery. So we will start for dehydration. So 2 of the following, dalawa sa pink, dalawa sa pink, pink, dalawa sa yellow, yellow, no significant signs, green. Okay. So pag severe dehydration, ito yung magiging treatment natin. If child has no other severe classification, you need to read this one, ha? Give fluid for severe dehydration, Plan C. So, ipa-follow mo yung Plan C specification. Makikita mo ang specification ng Plan C sa page 20. Okay, but before that one, meron din nakalagay dito or, hindi yan siya and, or. If the child also has another severe classification, you refer urgently to hospital with mother giving frequent sips of ORS on the way and advise the mother to continue breastfeeding. So, pwedeng ang batang may classification na severe dehydration, pwedeng hindi mo i-refer sa hospital. Kung wala siyang other severe classification, you just have to manage it with Plan C. Can you follow?
Yes po, ma'am.
Naintindihan pa ba? Okay. So if child is 2 years or older and there is cholera in your area, we give antibiotic for cholera. So cholera is another medical condition related to diarrhea. Okay? Ito yung other form of diarrhea. Okay, meron tayong cholera, meron tayong dysentery, yan yung other form of diarrhea. Okay, unahin natin itong Plan C. Page 20 ang ating specific content ng Plan C. Ayan. Ayan yung Plan C natin. Kita ba yan? Kita ba yan? Klaro ba yan?
Opo,
Yes
ma'am.
po, ma'am.
Okay. Treat severe dehydration quickly. Follow the arrows if answer is yes. Go across if no, and go down. Okay, start here. So can you give intravenous IV fluid? If yes, you need to follow the specific content. Okay. Meron kasi mga health center na meron sila mga standby na mga standard IV fluids. Okay? Start IV fluid immediately. If the child can drink, give ORS by mouth while the drip is set up. So give 100 ml per kilograms of lactated ringer solution, or if not available, normal saline or the NSS. So divided as follows. So ito yung dosage. Okay? Isa din yan sa dapat familiar kayo yung mga fluids natin, lalo na pag nag-ward na kayo. So dapat alam ninyo yung mga LR natin, the NSS, meron din tayong NaCl, sodium chloride, yan yun. Pero in managing dehydration, ito yung common na binibigay na fluid. Yung lactated ringer at saka normal saline or NSS. Okay. Infant under 12 months, we give 30 ml per kilogram in 1 hour. Then give 70 ml per kilogram in 5 hours. Okay. Ito yung dosage as well as yung number of hours kung ilang dosage ang ibibigay mo sa certain hour na ito. Okay. Children 12 months up to 5 years, 30 minutes. Ang 30 milligrams per kilograms in 30 minutes, and 2.5 hours, we give 70 milligrams per kilograms. Nakuha? Okay, repeat once if radial pulse is still very weak or not detectable. Kasi yung mga dehydrated, weak din ang kanilang pulse. So isa yan sa mga sign na dehydrated ang isang tao. Okay, reassess the child every 1 to 2 hours. If hydration status is not improving, we give the IV fluid drip more rapidly. We also give ORS as soon as the child can drink, usually after 3 to 4 hours for infants or 1 to 2 hours for children. We assess an infant after 6 hours and a child after 3 hours. Classify dehydration, then choose the appropriate plan A, B, or C to continue the treatment. Okay. All you have to do is to follow this arrow. Okay. Refer urgently to hospital for IV treatment. So nag-manage ka na, nag-IV fluid ka na, pero still, kailangan mo pa rin siyang i-refer. Is IV treatment available nearby within 30 minutes? Yes, ito yung i-follow mo. Okay? Are you trained to use a nasogastric tube for rehydration? If yes, you follow this instruction. Start rehydration by tube or mouth with ORS solution. We give 20 ml per kilogram per hour for 6 hours. We assess the child every 1 to 2 hours while waiting for transfer. And if there is repeated vomiting or increasing abdominal distension, we give the fluid more slowly. If hydration status is not improving after 3 hours, we send the child for IV therapy. And after 6 hours, we assess the child, classify dehydration, then choose the appropriate plan A, B, or C to continue the treatment. So, for short lang, ang ibig sabihin nito, from time to time, you need to assess the degree of dehydration. Kasi nagbabali din kung anong treatment ang gagamitin mo. If you're going to use plan A, plan B, or plan C pa rin. Okay, you can start managing or using the plan C, tapos after re-evaluation, pwede mo na gamitin yung plan A or plan B. Can you follow?
Yes po, ma'am.
Naintindihan ba?
Yes, ma'am. Yes po, ma'am.
Merong notations dyan. Okay, note, if the child is not referred to hospital, observe the child at least 6 hours after rehydration. To be sure, the mother can maintain hydration, giving the child ORS solution by mouth. So, kung talagang hindi possible na ma-refer yung bata, kailangan din natin siyang i-manage. So, ang cue lang dyan, kailangan i-hydrate ang bata. Kasi common cause of death is dehydration, particularly doon sa mga batang nagkakaroon ng diarrhea. Okay? So again, you just have to follow itong guidelines na ito. So kung ang per question, ang answer is no, you move to the next arrow kung ano yung specific item na gagawin mo. If yes naman, naka-stipulate din dyan kung ano yung specific na item na gagawin mo. Naintindihan ba? Okay ba, Miss Amegleo?
May question ako dun sa yung repeat once if radial pulse is still very weak or not. So, kung kunwari weak pa rin siya ma'am, then mag-ulit ka ng 30 ml per kilograms for 30 minutes. Again, yung sa next na ano ma'am, yung 40 ml na lang man ang matira sa 100. So, 40 na lang yung for 2.5 hours or 70 pa rin yung ibigay ma'am. Okay, 100 ml lang man lahat yung instruction.
Ano yun ulit? Sorry.
Ay, yung ano ma'am, for example, naka-give na ako ng 30 ml for 30 minutes, tas pag-check kay weak pa rin yung radial pulse ma'am. So mag-ulit na naman another 30 ml for 30 minutes. So 60 ml na yung na-administer ma'am. So sa next na ano is yung 2.5 hours ma'am, 70 ml pa rin po or yung natira na lang sa
Ay, hindi na.
100 ml. 40 na lang.
Natira na lang.
Sige
Kasi
ma'am.
you have to follow yung instruction na we only give 100 ml. So, naka-specify man dito kung ano yung division or ano yung, yes, anong division ng ating 100 ml. So, kagaya ng situation na binigay mo, na weak pa rin yung pulse niya, so nakabigay ka na ng 60, diba? So, kung after 60, nag-improve siya, diba? So, ubusin na lang natin yung 100 ml. Yung remaining ng 100 ml. Nakuha ba?
Opo.
Okay. Kasi we will only give the 70 ml kung na-follow ito first 30 minutes mo. 'Di ba? Basta ang tandaan mo lang, ang instruction kasi ng IMCI will only give 100 ml. So meron lang naka-specify dito na division ng 100 ml. Pero case to case pa rin ito. So yun nga, sa situation na sabi mo, na nakabigay ka na ng 60, tapos kailangan magbigay pa ng 70, after giving the remaining 40 man ang remaining, no? Tama ba? O, 40 ang
Yes
remaining.
ma'am.
After giving the remaining 40, i-reassess mo na naman ang bata. Nakuha?
Yes po.
Okay. Sige. Pasensya talaga kayo. I really need to read each item, content na inyong booklet. Kasi kung hayaan ko lang kayo, definitely hindi nyo ito babasahin. Diba? Diretso na lang mo dayon sa treatment. Tapos, kailangan din ba yung mga specific items dito? Okay? So, basta mag-ingon ako ba sa kapuyo, isa akong ganyan ni ma'am ang content sa booklet? Yes. Okay? Nakuha ba? Question so far? Naintindihan ba?
Yes
Hello?
ma'am.
Okay. Another treatment doon sa severe dehydration na emphasize yung cholera. So for specific content of your cholera, you check your page 12. Nandyan yung specific content ng ating cholera, kung anong management for cholera. So particularly ang ating cotrimoxazole and furazolidone. Okay, page 12. Kita nyo na yan? Yan. Hello? Kita ba?
Opo ma'am.
Okay, for cholera, first line antibiotic for cholera is cotrimoxazole. Alternate drug for cholera is your furazolidone. So pag tinanong kayo under IMCI, again ha, pwedeng ma-change itong mga management sa other protocol. But particularly for IMCI protocol, ang ginagamit nila na gamot for cholera is our cotrimoxazole as first line and furazolidone as our second line. And again, you need to follow the dosage stipulated here. So age and weight pa rin yan ang classification dyan. Tapos andyan yung mga strength ng ating preparation. Pag suspension, merong 400 milligrams per 200 milligrams na na preparation, meron ding 80 milligrams per 400 milligrams, meron ding adult tablet, at saka itong furazolidone, ito din yung preparation niya. Okay, baka magtaka kayo, ma'am, bakit may adult dyan? Akala ko ba ibibigay lang siya sa bata? Kung sakaling unavailable itong suspension mo na 40 milligrams per 200 milligrams or 80 milligrams per 400 milligrams, you may make use of this adult tablet with a strength of 80 milligrams per 400 milligrams, but you will only give the certain amount. Nakuha? Hello? Diba?
Yes po, ma'am.
Kaya good vitamin A natin, di ba ang preparation? Yes. May question ba? Hello? Okay
Wala
ba
po.
yon?
Opo, ma'am.
Okay. Kagaya lang din ng vitamin A natin. Di ba ang preparation ng vitamin A natin is the 100,000 IU and the 200,000 IU. In case unavailable yung 100,000 IU, alangan naman hindi na natin siya bigyan ng vitamin A. We can make use of the 200,000 IU. Yun lang may certain dosage. So instead of consuming the 200,000 IU, you will only give 2 to 3 drops. So same lang din ang concept pag unavailable yung preparation, ideal for a particular age. Nakuha? Hello?
Opo.
Okay, sige. Sa plan B naman natin, particularly sa SAM dehydration, ang significant treatment sa SAM dehydration natin is the plan B. Okay, pakita ko sa inyo ha. Ayan. Nakalagay dyan. SAM dehydration, dalawang signs dito, we classify it as SAM dehydration. So give fluid, zinc supplements, and food for SAM dehydration, plan B. If a child also has severe classification, refer urgently to a hospital with mother giving frequent sips of ORS on the way and advise the mother to continue breastfeeding. Okay? Advise the mother when to return immediately and follow up in 5 days. So let us check Plan B content. So page 19 yan, makikita ang ating Plan B. Ayan. Plan B. Ayan. Treat SAM dehydration with ORS. In the clinic, we give recommended amount of ORS over a 4-hour period. So you determine the amount of ORS to give during the first 4 hours. So nakalagay dyan kung ano yung specific na ibibigay mo according to age and the amount. Okay? So use the child's age only when you do not know the weight. The approximate amount of ORS required in ml can be calculated by multiplying the child's weight in kilograms times 75. Ayan yung specific item to calculate. Okay, if the child wants more ORS than shown, give more. For infants under 6 months who are not breastfed, also give 100 to 200 ml clean water during this period. If you see standard ORS, this is not needed if you use new long osmolarity ORS. Kung ano lang yan ito, specification or mga classification ng ORS natin. Show the mother how to give ORS solution. We give frequent small sips from a cup. If the child vomits, wait 10 minutes, then continue, but more slowly. Continue breastfeeding whenever the child wants. Kasi itong mga ORS natin, medyo salty ito baka ng parat. So, ang iba nasusuka talaga nito. So, hindi din pwede na hindi mo na lang siya bigyan ng ORS kaya nagsuka man siya. Since ang ating ORS is a form of management, we really need to give the ORS to hydrate the child. So, after 4 hours, you reassess the child and classify the child for dehydration. So, merong reassessment. Select the appropriate plan to continue treatment and begin feeding the child in clinic. If the mother must leave before completing the treatment, show her how to prepare ORS solution at home. Show her how much ORS to give to finish a 4-hour treatment at home. And give her enough ORS packets to complete rehydration. Also give her 2 packets as recommended in Plan A. Itong mga ORS natin, powder form, dito siya na nakalagay sa sachet. Nakakita na ba kayo ng ORS? Ha? Anybody? Nakakita na ba kayo nito? Wala pa. Lahat?
Wala pa, ma'am.
Wala pa,
Wala.
ma'am.
Wala pa po.
Ma'am.
Para
No,
siyang,
ma'am.
para gani siyang, sa sachet ba? Murag shampoo, pero nakabutang siya sa gamay po siya. So powder form ni siya, i-dissolve ni mo ni siya sa water. Yung mga social na ORS, yan yung mga Pedialyte, yung parang mga flavored na drink, yung parang nakalagay sa dextrose, yan yung other preparation ng ating mga ORS. So ang gina-release ng WHO na ORS, nakalagay yan siya sa packet, sa sachet. Okay? Okay. So explain the 4 rules of home treatment. So may mga may mga treatment tayo under diarrhea na we follow this home treatment. So we advise the mother to give extra fluid. We advise also the mother to give zinc age 2 months up to 5 years. Naka-specify dyan ha, kung sino lang yung bibigyan ng zinc. Continue feeding, exclusive breastfeeding if age less than 6 months, and when to return. Okay, ito yung content ng 4 rules home treatment. Nakuha? Hello?
Opo, ma'am.
Yes po, ma'am.
Yes po, ma'am.
So, ang bata namang may diarrhea pero walang dehydration, ang significant treatment sa kanila is the Plan A. So, ito yung Plan A treatment natin. So, ngayon, ang 4 rules home treatment natin, di ba, ang green row, more on home treatment. So, nakataas na siya ngayon, this time, sa Plan A. Counsel the mother on the 4 rules of home treatment. Give extra fluids, supplements, continue feeding, and when to return. Okay, ito naman yung mga specific content ng ating 4 rules home treatment. So we tell the mother to breastfeed frequently and for longer at each feed. If the child is exclusively breastfed, we give ORS or clean water in addition to breast milk. If the child is not exclusively breastfed, we give one or more of the following ORS solution: food-based fluids such as soup, rice water, yogurts, or drinks, or clean water. So ito yung mga replacement natin aside sa kanilang formula milk. It is especially important to give ORS at home when the child has been treated with Plan B or Plan C during the visit. The child cannot return to a clinic if the diarrhea gets worse. Okay? Teach the mother how to mix and give ORS. Give the mother 2 packets of ORS to use at home. And show the mother how much fluid to give in addition to the usual fluid intake. So, andyan yung dilution natin, 50 to 100 ml after each loose watery stool. And bigyan mo ng 100 to 200 ml yung batang 2 years and above after each loose stool. Okay, replacement ito. Diba? Kasi sa mga hospital, yung mga batang may diarrhea na admitted sa hospital, continue yung IV fluids nila. Ito naman yung replacement management natin na walang dehydration ang bata, pero still, we need to avoid dehydration. Kaya binibigyan natin sila ng extra fluid, particularly yung ORS. So we tell the mother to give frequent small sips from a cup. If the child vomits, wait 10 minutes, then continue but more slowly. Continue giving extra fluid until the diarrhea stops. Okay, ang giving of zinc. So pag nag-duty na din kayo sa pedia, sa ward, pedia ward particularly, common itong zinc. Makita ninyo ito sa mga medicine ng mga pediatric patient. Maraming zinc, metronidazole, yan yung mga common na mga meds na nakikita ninyo. Okay. Supplement itong zinc, vitamins ito. Tell the mother how much zinc to give. Again, this is based on age. This time, walang weight nakalagay dyan. So, based siya sa age. So, no need to take the weight. Ha? Okay, nakalagay dyan ang age. So, ito lang yung ipa-follow ninyo kung ano yung strength based sa age ng bata. Okay. Show the mother how to give the zinc supplements for infant. We dissolve tablet in a small amount of expressed breast milk, ORS, or clean water in a cup. Older children naman, tablets can be chewed or dissolved in a small amount of water. Then, another for home 4 rules home treatment is to continue feeding, so exclusive breastfeeding if age is less than 6 months, and you need to advise when to return. Can you follow, guys?
Yes,
Yes
ma'am.
po.
So after dehydration, what's next? After checking the degree of dehydration and classified as acute diarrhea, ano ang next?
First.
Sino yon? Yes? Who's talking? Hello? Di maulaw. Kaya kung mali, di man ka mo kasabaan. Sino yon?
Persistent
Persistent ano? Sino yon?
diarrhea, ma'am.
Magsaway ba yon? Sino yon nagsasalita? Hindi ko makita ko.
Amigleo po.
Amigleo, oh. Is amigleo, persistent diarrhea. So after checking the degree of dehydration, tapos 14 days or more ang diarrhea ng bata, bababa ka dito sa column na ito. So titingnan mo ngayon kung present ang diarrhea, i-classify mo based sa presence ng presence ng dehydration or absence ng dehydration. So nandito yan siya nakalagay. Ayan. If diarrhea is 14 days or more, dehydration present, you classify it as persistent diarrhea, severe persistent diarrhea. Pag wala namang dehydration, tapos 14 days or more yung diarrhea, persistent diarrhea. So anong treatment dyan? Treat dehydration before referral unless the child has another severe classification. So basahin talaga yan ha, nakaspecify talaga dyan. Okay? Refer to hospital. Okay, pag no dehydration naman pero merong persistent diarrhea, advise the mother on feeding a child who has persistent diarrhea. We give multivitamins and minerals including zinc for 14 days. So makikita mo ang specific item, content ng giving of zinc and vitamins sa page 19. So buklatin lang natin sa liter. Tapos nakalagay din dyan ang giving of vitamin A, follow up in 5 days. Okay, pag ang bata naman gina-diarrhea tapos may blood in the stool, meron man siyang dehydration or wala, you classify it as dysentery. So lalabas dito sa batang may classification na dysentery, you are classifying the degree of dehydration as well as you need to write dysentery. So particularly, ang treatment for dysentery is giving of ciprofloxacin for 3 days, follow up in 3 days, advise mother when to return immediately. So unahin natin itong persistent diarrhea natin. So sa persistent diarrhea, we will check the giving of zinc on page 19. Page 19. Ayan. Ayan. Okay pa ba, students, ang 2M?
Yes po, ma'am.
Okay, sige, salamat. Ayan. Ang zinc natin. Ito yung dosage ng ating zinc. So, i-mention ko na yan kanina. Ang age lang ang classification niyan. So, andyan yung mga preparation. Depende kung ilang strength ng zinc ang ibibigay mo based sa age ng bata. Okay, based naman sa ating giving of vitamin A, nasa page 16. Ayan yung dosage ng vitamin A. Alam naman ninyo yung vitamin A, di ba? Sa community lecture pa lang, naririnig nyo na itong vitamin A. Di ba? Am I right? Hello?
Opo, ma'am.
So part siya ng immunization. Usually, binibigay siya together with measles vaccine. So we give vitamin A supplementation and treatment. So vitamin A supplementation, give first dose anytime after 6 months of age to all children. Thereafter, vitamin A every 6 months to all children. So mag-start ng vitamin A supplementation at 6 months, interval ng 6 months. Vitamin A as treatment. So nakalagay, supplementation yan at saka treatment. 'Di ba meron akong ginamention sa inyo na ang batang may measles, kahit na hindi pa due ang kanyang vitamin A, we give vitamin A. Okay, as treatment. So give an extra dose of vitamin A, same dose as for supplementation for treatment if the child has measles or persistent diarrhea. So vitamin A as treatment, we can give this one regardless kung wala pa due, hindi pa due ang kanyang interval. So if the child has had a dose of vitamin A within the past month or is on RUTF for treatment of severe acute malnutrition, we do not give vitamin A. Nakuha? Nakasama dyan yung RUTF. Okay. Always record the dose of vitamin A given on the child's card. So 6 up to 12 months, you give the 100,000 IU. Ang preparation color nito is naka-blue. Diba? Nakita nyo na ito? Itong vitamin A? Para siyang rubberized capsule na para siyang grenade na all you have to do is to cut the the upper portion tapos i-squeeze lang ito. Okay. Ang 100,000 IU blue ang color, ang 200,000 IU red ang color. But always do not base on the color of a particular meds. Always read the label. Kung hindi kayo sure sa mga meds ninyo, sa mga medicine na walang container, discard that medicine. Nakuha? Hello?
Ma'am.
Yes po.
Yes? Okay na? May question ba? Okay, sige. Next, blood in the stool or dysentery. Ang significance na treatment sa mga batang may dysentery or classified as dysentery is giving of ciprofloxacin for 3 days. So, you check the content of ciprofloxacin on page 12. Ayan. Ciprofloxacin. Ayan. Ayan, maliit lang. For dysentery, we give ciprofloxacin. First line antibiotic is oral ciprofloxacin. Ayan. So, andito pa rin yung age niya. So, walang weight dyan. Less than 6 months, may preparation tayo na 250 tablet. Meron din tayong 500 milligrams tablet. So, kung unavailable ang 200 milligrams tablet, pwede mong bigyan ng 500 milligrams tablet, pero 1/4 tab lang. Pero in general, we discourage this one na ginatunga lang nato ang tablet kasi hindi tayo makasure na yung kalahati niya, they can really get the strength of a particular drug. Diba? Even though paracetamol, kunyari 500 ang ating biogesic, tapos may scourge man yan, tungaon lang ninyo para 250 lang ihatag. Diba nakasure na katong tunga niya, 250 good ang strength ato. Yun lang, in worst cases na wala talaga tayong unavailable niya, kailangan natin bigyan, pwede natin to i-follow. Pero kung available man lang, you follow the correct dosage of a particular drug. Nakuha? Okay.
Yes
For
po, ma'am.
recitation, sino pa hindi naka-recite? Sino pa hindi naka-recite? Raise your hand, please. Si Solana. Okay. Mrs. Solana, question lang. Ano ang next symptom after diarrhea? Mrs. Solana. Cough, diarrhea, the next?
Fever po, ma'am.
Yes. Follow-up question. Ano yung mga classification ng mga batang may fever? Possible classification.
Malaria po, ma'am, measles, and dengue hemorrhagic fever.
Yes, that's correct. So, pero according to IMCI, i-rule out mo ang fever na hindi siya malaria, measles, and dengue, and you need also to identify other cause of fever. Kung bakit ginalagnat ang bata. Kung hindi man siya malaria, hindi man siya measles, hindi man siya dengue, ano yung other cause of fever. Okay, punta tayo ngayon sa malaria. Ayan. Tapusin lang talaga natin hanggang ear problem. Tapos, ito continue lang natin to. Hindi ko naman exhaust yung hanggang 7. Ayan. Okay. Ito ha, ulitin ko lang kaya marami nagkakamali dito. Okay. Pag batang may fever, you need to identify if the fever is by history, feels hot, or temperature of 37.5 or above. So maraming walang answer dyan sa quiz. Okay. Another thing is, you need to identify kung ang bata na belong sa malaria area or non-malaria area. Kasi meron tayong malaria risk and no malaria risk classification. So any general danger sign or batang may fever plus meron siyang stiff neck, you classify it as very severe febrile disease. Malaria, tapos na belong siya sa malaria area or kahit hindi siya na belong sa malaria area, pag positive yung kanyang malaria test, you classify it as malaria. Okay. Malaria test negative, pero na-belong siya sa malaria area, and meron siyang other cause of fever, you classify it as fever, no malaria. So huwag kalimutan ito. If no malaria test available, and if in a malaria risk area, classify as malaria if no obvious cause of fever. Nakuha? Can you still follow, guys?
Yes po.
Yes.
Yes,
Po,
ma'am.
ma'am.
Dito tayo sa mga treatment ha. Dito muna tayo sa malaria risk. Give first dose of artesunate or oral quinine for severe malaria under medical supervision. Give first dose of appropriate antibiotic. So aside from giving yung ating artesunate or anti-malarial drug, we can give appropriate antibiotic, which is our amoxicillin. We treat the child to prevent low blood sugar. Na-discuss na natin yung mga content niyan. Give 1 dose of paracetamol in the clinic for high fever. So nakaspecify talaga dyan ang temperature before you can give paracetamol. So pag hindi siya 38.5 or above, you will not give paracetamol. But still, you will manage the high fever. You will manage it with TSB. Nakuha. So despite of TSD, nag-increase na siya sa 38.5. Initial, ang temperature niya is hindi siya nag-fall ng 38.5. Tapos after TSB, hindi siya bumaba, nag-increase siya. That's the time you will give paracetamol. Okay? Basta ang cue mo lang dyan, pag ang temperature ng bata 38.5 or above, you can give paracetamol. Then refer urgently to hospital. But again, you need to manage it first before you refer the child to hospital with referral. Okay? So sa malaria, mga significant dyan, we have the artesunate. So to check the content of artesunate, you can check page 18. So sa page 18, makita natin yung artesunate. Give artesunate suppositories or oral quinine for severe malaria. So some would pronounce it as quinine, some would pronounce it as quinine. Okay? For children being referred with a very severe febrile disease, check which pre-referral treatment is available in your clinic. Rectal artesunate suppositories, artesunate injection, or quinine. Ibig sabihin nito, before mo i-refer ang bata, pwede mo na siya ibigyan ng initial dose. So, i-check mo lang ang availability ng mga artesunate na ito. Okay, artesunate suppository, insert first dose of suppository and refer child urgently. Oral quinine, give first dose and refer child urgently to hospital. So again ha, bibigyan mo muna nitong mga pre-referral treatment before sila magpunta sa hospital. If referral is not possible for artesunate suppository, you give first dose of suppository, repeat the same dose of suppository every 24 hours until the child can take oral anti-malarial. Give full dose of oral anti-malarial as soon as the child is able to take orally. Okay, for quinine naman, give first dose of oral quinine, pulverized tablet, and give through NG. So kung nakakabit ka ng NGT, pwede natin ibigay yung kinin solution natin or tablet through NGT. But again, kailangan yun i-pulverize, ha? Okay. Ito naman yung mga specific dosage ng mga artesunate suppository natin at saka oral quinine based on age or weight. Again, mas may bearing ang weight over the age of the child. Nakuha? Other treatment for very severe febrile disease, malaria, antibiotic, amoxicillin, prevent low blood sugar, paracetamol, and refer urgently to hospital. Okay, for malaria naman, we can give the first line anti-malarial drug, which is your artemether-lumefantrine. Artemether-lumefantrine can be seen on page 13. Ito yung content ng ating artemether-lumefantrine. Okay, can you still follow? Are you still there?
Yes, ma'am.
Naghangak-hangak ng kudirin niya, wala mo. Okay, give oral anti-malarial for falciparum malaria. Ito yung species ng malaria, ha? So we give artemether-lumefantrine. Give the first dose of artemether-lumefantrine in the clinic and observe for 1 hour. If the child vomits within an hour, repeat the dose. Give second dose at home after 8 hours. So, gina-specify lang dito kung pwede mo na mabigay yung initial dose tapos instruction on the succeeding dose. Then twice daily for further 2 days as shown below. Ito yung specification. Artemether-lumefantrine should be taken with food. Naka-specify dyan. So, with full stomach, ang pagbigay ng ating artemether. Artemether, advise patient to take artemether-lumefantrine with milk or fat-containing food, gata or coconut milk, buko or suman, salatik and cookies. Ito yung mga example, particularly on the 2nd and 3rd days of treatment. Since lumefantrine is highly lipophilic, its absorption is enhanced by co-administration of fat, low blood levels, would result in treatment failure and could potentially result from the inadequate food intake. So, best absorb yung ating artemether-lumefantrine pag binibigay siya together with the following. Okay? So, ito naman yung dosage ng ating artemether-lumefantrine. So, weight, age, use body weight in kilograms as basis. If weight cannot be taken, use age as basis. So, ito yung preparation, 20 milligrams artemether with 120 milligrams lumefantrine. Combination ito. Primakin naman can also be given in replacement of your artemether-lumefantrine. Itong primakin natin, ang classification nito is also anti-malaria. Nakuha? Okay?
Yes, ma'am.
Yes, ma'am.
Okay. Dito tayo ngayon sa paracetamol. Okay. Sino yung binibigyan ng paracetamol? Anybody? Hindi pa naka-recite. Sino yun? Bigyan na lang muna natin ng chance yung mga student na hindi pa naka-recite. Sino pa? Sorry ha, hindi ko na-prepare kasi hindi naka-recite. Sino pa? Sige na, para may 100 na kaagad. Sino pa yung hindi naka-recite? Wala na ba sa 2M? Magtatagal City ang mga naka-off na lang ang tambi. Lamoste. Naka-recite na ba si Miss Lamoste? Miss Lamoste?
Mana ako, ma'am, katong sa face-to-face po, ma'am.
Wala si Miss Lamoste. Pag-release pa nag-on mo. Cabrera. Natapos na pala si Cabrera. Sino yung nag-release? Marasigan. Yes, Miss Marasigan.
Mr. Ron.
Mr. Marasigan, sorry.
For ano po, high fever po,
High fever,
38.5
particularly 38.5 or above. Actually, pwede din siyang ibigay yung paracetamol natin doon sa mga batang may ear pain. Okay. Diba? Common management ng paracetamol. Let's check for paracetamol. So it can be seen on page 14. Ayan. Give paracetamol for high fever, more than 38.5 degrees Celsius temperature or ear pain. Give paracetamol every 6 hours until high fever or ear pain is gone. Yan yung specification in giving paracetamol. So again, it is based on age or weight, tapos merong mga available strength dyan. Itong mga strength yan yung 120 milligrams per 5 ml, 250 milligrams per 5 ml with the specific dosage. Nakuha? Okay ba? Okay, so same with fever. No malaria. So sa malaria natin, we give artemether lumefantrine as our first anti-malarial drug. Then we also manage it with paracetamol. For fever, no malaria naman, we can also give, one of the management is giving of paracetamol. So we give also appropriate antibiotic doon sa identified other cause of fever. And for an identified, identified cause of fever. Naintindihan ba yun? Hello? Can you still follow?
Yes,
Yes,
ma'am.
Ma'am,
ma'am.
pwede po paulit, ma'am.
Anong ulitin ko? So, yung ating malaria, ang common dyan is giving of anti-malarial drug. So, sa severe malaria natin, we can give artesunate or quinine. So, makita mo yung dosage or specific content ng ating quinine at sa artesunate sa page 18. Sa malaria naman na classification, ang common management dyan is giving of artemether lumefantrine. So makikita mo sa page 30. Tapos meron siyang malaria plus increase ang kanyang temperature, particularly 38.5 or more. You can also manage it with paracetamol. So ang specific content ng paracetamol nandito sa page 14. Okay, sa fever, no malaria naman, paracetamol ang common management plus kung merong identified other cause of fever, we can manage it with appropriate antibiotic, particularly amoxicillin. Can you follow? Intindihan ba? Nasagot ko ba yung question? Ay, yung clarification? Okay na ba yung gi-repeat ko?
Yes po, ma'am.
Okay. So, anong next after malaria? Anong next? Anong possible classification? Next? Sige, sagot na lang kahit na naka-recite.
Dengue. Dengue, ma'am.
Dengue
po,
ba?
ma'am.
Dengue pa ka ba?
Measles.
Measles.
Ay, measles, ma'am.
Yes, very good. Measles. So, sa measles natin, ito yun. Ang measles, pwedeng the last 3 months or measles now. So, ginatanong natin itong measles. Ma'am, wala ba measles si baby for the last 3 months? Kasi wala kang makitang signs of measles. Wala siyang generalized rash. Wala siyang complications of measles, the 3 C's, the cough, coryza, and conjunctivitis. So, pag measles now lang siya or within the last 3 months, you classify it as measles. Can you follow? Naintindihan niyo ba ito?
Yes,
Maraming
ma'am.
Yes,
nagkamali.
ma'am.
Yes po, ma'am.
Okay. So, ginatanong ito ha. So, if measles now, kung present yung generalized rash na and 3 C's, you check if it is severe complicated measles or measles with eye or mouth complications. Kung wala naman itong signs of measles, pero nagka-measles siya for the last 3 months, you classify it as measles only. Okay, unahin natin ito. Any general danger sign or may clouding of the cornea or may deep or extensive mouth ulcer, you classify it as severe complicated measles. Okay. Ang management dyan, ang common sa tatlo is giving of vitamin A. So yung vitamin A strength natin, we have the 100,000 IU, 100,000 IU, and the 200,000 IU. So, nabasa ko na sa inyo kanina yung mga specifications in giving vitamin A. So, we also have this give first dose of appropriate antibiotic. So common antibiotic natin is the amoxicillin. If clouding of the cornea or pus draining from the eye, apply tetracycline eye ointment. This is also an antibiotic to manage eye problem. So tetracycline eye ointment. So makita natin yung specific content ng tetracycline sa page 15. Okay, mamaya ko na lang, isahin ko na lang pagbuklat, ha? So refer urgently also to the hospital yung may mga severe complicated measles classification. Pag sa yellow row naman, meron siyang measles now, tapos pus draining from the eye or mouth ulcers, you classify it as measles with eye or mouth complications. So ang management, giving of vitamin A, if pus draining from the eye, apply tetracycline ointment. If mouth ulcer, we teach the mother to treat with gentian violet. So under pa rin yun sa IMCI. Follow up in 3 days and advise mother when to return immediately. Okay, wala siyang complications pero nagkaroon siya ng measles for the last 3 months. We classify it as measles and we give vitamin A as treatment and not as supplement. Naintindihan? Hello?
Yes, ma'am.
Yes
ma'am.
po.
Yes po, ma'am.
Check natin yung tetracycline for eye infection. So page 15, ayan yung giving of tetracycline ointment. Klaro pa man yan, no? Pabasa man ninyo on your end.
Yes po.
Yes po, ma'am.
Treat eye infection with tetracycline eye ointment. So we clean both eyes 4 times daily. Isa ito sa instruction natin. We wash our hands, as always naman, before and after. We use clean cloth and water to gently wipe away the pus. So wag naman kaagad lagyan mo ng eye ointment. Linisan mo muna yung area. Okay, from inner canthus to outer canthus. Nakikita niyo man ako, no? Hindi ko lang
Opo.
sarili ko. From inner to outer canthus. So pag kuan mo, madumi pa rin, get another. It's either yung mga cotton pads. Are you familiar with cotton pads? O, kung
Opo.
sabihin niyo social naman si ma'am, cotton pads pag yun, tapos sa Muji pag yun ipalit ang cotton pads. Hindi naman. Yung mga clean cloth lang. Clean, ha? Hindi necessarily sterile. So, clean cloth, you clean from inner to outer canthus. Then after, pag malinis na siya, that's the time you apply your tetracycline ointment. Yung mga preparation ng tetracycline natin, para din siya, intended talaga siya for eye ointment. Na meron ganin siyang dulo na parang narrow, na doon nagalabas yung ointment na ang ointment din niya parang paglabas niya is parang pencil-like ba? Di ba na yung mga ointment preparation pag squeeze mo buong buo? Yun naman, pag tetracycline ointment, ang preparation niya, para din siyang nakaline. Para bang eyeliner? Hello, can you follow?
Yes po, ma'am.
Yes, ma'am.
Yes po, ma'am.
Imagine nyo yung ginasabi ko. Di ba yung standard ointment natin, pag squeeze mo, malaki kaagad yung lumalabas? Yun naman mga tetracycline ointment natin or eye ointment na preparation, meron niya siyang narrow dyan na labas sa ointment na pag squeeze mo niyan, para mo lang din siyang ma-eyeline. Maline mo sa mata. Hoy.
Yes, ma'am. Nakagawa na kami niyan, ma'am, nung nag-newborn caring po kami, ma'am.
Yes, tama. Sa DR, sa newborn caring. Prophylaxis, di ba?
Opo, ma'am.
Ito po ang pag-explain. Okay, you squirt a small amount of ointment on the inside of the lower lid. Wash again. Then treat until there is no pus discharge and do not put anything else in the eye. Kasi meron mga practice sa community. Pag meron ganing conjunctivitis or red eyes or ano ganing tawag niyan sa layman's term niya, sore eyes, di ba? Layman's term yung sore eyes. Di ba, ginapatuluan nila o breast milk? Actually, yung breast milk, pwede din yun siya. Kasi ang effect ng breast milk natin is cooling effect lang yun. Pero wala yung antibacterial effect. Cooling lang yung effect nun. Nakuha nyo?
Yes po, ma'am.
Yes po,
Okay.
ma'am.
So, vitamin A, hindi ko na yan ulitin. What about in managing mouth ulcer? So we manage it with Gentian violet. So ito yung preparation ng ating Gentian violet. Kita ninyo ito. Treat for mouth ulcers with Gentian violet. We treat for mouth ulcers twice daily. Wash the hands, wash the child's mouth with clean, soft cloth wrapped around the fingers and wet with salt water. Yung water lang, yung tap water lang natin, ginahaluan lang natin yan ng asin. Minsan ginagamit natin yung pang gargle pag meron kang sore throat. Ito naman, to come up with NSS, you can improvise. Meron kang water tapos mix it with salt. Paint the mouth with half strength with Gentian violet 0.25 dilution. Wash hands. Continue using GB for 48 hours after the ulcers have been cured and give paracetamol for pain relief. So, meron tayong preparation ng ating Gentian violet. So, ito yung preparation ng ating Gentian violet. Ayan. Nakikita nyo yan? Hello? Nag-change ba ang screen ko?
Hindi po, ma'am.
Wala, ma'am.
Wala, ma'am.
Ayan. Kita nyo na yan?
Yes, ma'am.
Yes, ma'am.
Ito yung Gentian violet natin. Violet talaga siya. Anong parang nare-relate ito siya doon sa ginagamit yan pag ginabayuok ka. Yung moms. Pero aniel yung
Aniel po, ma'am.
O, hindi yung Gentian violet. Parang ganun lang yun. Okay. We paint Gentian violet 2 times a day for 5 days. So, how to prepare your Gentian violet? So, ang isang Gentian violet to 1%, double strength yan, 15 cc. So, if you want a 30 cc full strength, so kukuha ka ng 15 cc, dagdagan mo ng 15 distilled water to get a 30 cc. Nakuha? Meron din preparation na 0.25. So, kukuha ka ng 1%, 0.5 pala percent of Gentian violet, dagdagan mo ng 30 cc distilled water to get a 60 cc half strength. Okay? Usually, ang ginagamit natin pag mouth ulcer, 30 cc full. Pag mga skin pustules na ma-discuss natin sa ating sick young infant, may mga skin pustules, ang ginagamit natin is the 0.5 full strength or the 60 cc half. Nakuha? Nag-take ba kayo ng screenshot nito or i-copy nyo ito? Ito yung preparation ng ating Gentian violet. Hello?
Nag-take na po, ma'am.
Okay, thank you. So, okay na yan.
Opo, ma'am.
Okay. Sige. Sa mga measles classification naman natin, again, vitamin A lang ang management natin. So, we give additional dose of vitamin A doon sa mga batang nabigyan na ng vitamin A pero nagkakaroon ng measles o may measles now. Nakuha ba?
Opo, ma'am.
Okay. Last. Dengue hemorrhagic fever. Basta 6, mag-end na tayo. Okay. Severe dengue hemorrhagic fever, we give ORS, plan B. So, dengue hemorrhagic fever tayo. Okay. Ito lang ha, i-emphasize ko lang ha. Kasi, ito, kahit na green row yan, you need to place the classification of fever, dengue hemorrhagic fever. Ulitin ko lang, pag nag-yes ka sa taas na does the child have fever, dapat yung dengue item naka-yes din. Kasi gina-rule out mo na hindi yung fever measles, hindi ang fever brought about by malaria, and hindi din siya dengue. No signs of severe dengue hemorrhagic fever, only yung capillary reveal na normal naman ang capillary reveal, you classify it as fever, dengue hemorrhagic fever, unlikely. Pero isa dito sa item, bakit ma'am isa lang? Kasi nakalagay dyan, or. So, bleeding from the nose or gums, or. Meron siyang bleeding in the stool or vomitus, or. Black stool or vomitus vomitus, or skin petechiae, or etc., you classify it as severe dengue hemorrhagic fever. So kung wala namang significant sign, then classify it as severe fever, dengue hemorrhagic fever unlikely. Nakuha?
Yes po, ma'am.
Okay. So anong treatment ng severe DHF natin? It's persistent vomiting or persistent abdominal pain or skin petechiae or positive tourniquet test are the only positive sign we give the ORS plan B. Yung plan B na specification na ginagamit natin sa dehydration, yun pa rin ang ito-follow natin. If any other signs of bleeding are present, we give fluid rapidly. Follow the plan B guidelines. Okay? Treat the child to prevent low blood sugar. Yung pag-prepare natin ng sugar water, yun pa rin ang ginagamit natin. Refer all children urgently to hospital and do not give aspirin. So sa fever, dengue, hemorrhagic fever, and guideline naman, we give ORS, advise mother when to return immediately, follow up in 3 days if fever persists or child show signs of bleeding, and we do not give aspirin. Nakuha? Okay. Para lang makuhaan ninyo, yung plan B natin makita sa page 19, yung plan C makita sa page 20. Nakuha pa? Hello?
Yes po, ma'am.
So, to the last, ear problem, para hindi lang tayo makuha. Wala pa bitaw 6. Ear problem. So, ear problem, acute, chronic, and mastocytosis. So, tender swelling behind the ear. So, pag-check mo doon, yes, may problema ba sa na yung baby mo, ma'am? Oo, sige man siya gunit niya, magsigigil lang. So, you need to further assess. So, you check the mastoid bone, kung nag-inflame yan siya, tapos lalo na paghawakan mo, mag-iyak si baby, painful yun, meron siyang mastoiditis. Pag meron pag yung pag-check mo, meron pag yung pus na nagalabas sa tenga. Pus is seen draining from the ear and discharge is reported for less than 14 days, or merong ear pain, acute ear infection. Pag meron namang pus na or luga or buog na nagagawa sa tenga for more than 14 days, you classify it as a chronic ear infection. Initially, nag-complain ang mother na parang may problema si baby sa tenga, pero wala namang ear pain, wala namang pus na nagalabas sa tenga, no ear infection. Nakuha? Okay. Treatment tayo. Give first dose of appropriate antibiotic. Ano nga antibiotic binibigay natin? Standard antibiotic na binibigay natin under IMCI? Hello?
Appropriate.
Amoxicillin. Paracetamol is for fever and pain. Give first dose of paracetamol for pain and refer urgently to hospital. Pag naka-pink row, pag naka-yellow row naman siya, mapansin niyo dalawa yung classification sa yellow row. Acute infection and chronic ear infection. So again, management, give an antibiotic for 5 days, particularly ang amoxicillin, give paracetamol for pain, and dry the ear by weeking. How to do this? Dry the ear by weeking. You can check page 15. Yan yung common ha. Meron din tayong treat with topical quinolone. So, i-check na natin siya later. Okay. Punta muna tayo sa dry the ear by weeking. So, makita natin yan siya sa page 15. Kunti pasensya na lang. Tapos nyo. Kanina pa ba mo nag-klase o ako lang nag-klase?
7 to 7 po, ma'am.
Talaga mga estudyante. Ilang. Isipin nyo na lang marami rin bakasyon. Okay. Clear the ear by dry weeking and give ear drops. Kita niyo yan? Hello?
Yes.
Yes po, ma'am.
Dry the ear at least 3 times daily. Roll, clean, absorbent or soft, strong tissue paper each week. Place the wick in the child's ear. Remove the wick if left. Replace the wick with a clean one or replace repeat these steps until the ear is dry. How to go about this? So, paano mag-dry the ear? Alam niyo yung mga paper towel? Paper
Yes,
towel
po.
or regular tissue. Pero mas maganda yung paper towel kasi absorbent lang. Diba? Yung mga nakikita ninyo sa CR, sa mga social ng hotel, na after washing the hands, meron mga paper towel. For example, ito ang paper towel. Kita mo naman ano? Ako lang hindi makakita sa sandali mo. Kita nyo ito? Ay, man.
Sa
Ganyan.
background.
Para makita. Okay. Ito ang paper towel. Kita yan, hindi.
Makita, ma'am.
Kita po, ma'am.
You just make a cone. Parang cone ba? Kanyari, ito ang paper towel. Ito ang cone. Yan, ganyan. You just fold the paper towel like this. Kita niyo yan?
Opo, ma'am.
Ilagay lang yan siya sa tenga. Huwag naman masyadong sa loob ng tenga. Kasi sa IMCI, we don't recommend using cotton buds. So, nagagawa talaga tayo ng wing. Ilagay mo lang yan siya sa loob ng tenga. Hindi talaga sa loob ng loob. Yan parang sa middle lang ba? Tapos absorb lang yan ng kanya kung merong pass. Tap mo lang yan siya ng ganyan. Pagkita mo merong pass yan siya. So you get another one. Tap until dry na siya. Before you instill the quinolone drops. Instill quinolone ear drops after drying 3 times daily for 4 days. Itong ciprofloxacin, floxacin, o flofloxacin, ito yung mga brand ating quinolone drops. And you follow
Yes po, ma'am.
the same pattern. Kahit na maglagay ka ng ointment, kailangan linisan mo muna ang eye mo. Kailangan linisan mo muna yung mata. So, pag mag-instill ka naman ng quinolone drops, kailangan mo muna linisan yung tenga. So, you dry. So, ito, ipatong mo lang yan dyan, mag-absorb na yan ng pass. Tapos, until naman dry. Kunyari, pag dumi pa rin, second try naman, dumi pa rin, meron pa rin malasa, get another one until dry. Para hindi maghalo yung drops mo doon sa paa. So, ma-absorb talaga ng yung quinolone drops. Naintindihan ba?
Opo, ma'am.
Okay, very good. Okay, ano pa significant dyan? Okay. That's it for ear drops. So, hindi ko na exhaust. We will just continue with the other treatment and the other content of your IMCI on Thursday. But again, please be reminded, tomorrow, we will not meet, but need to take the quiz set at 4:30. And before that one, this will be your paper code. Ayan. Present na po, Lucy. Ayan. Ito yung paper code. May mga question ba kayo? Klaro ba yung lecture ko?
Yes po, ma'am.
Yes. Di ba masyadong, yes, di Imci.
Clarify lang din, ma'am, kay when it comes to the dosage ganit, ma'am, kay again, may mga classification or parang may need to follow dyan din kapag we're going to give the right amount of dosage per medication sa mga bata, ganit, ma'am. And as you have mentioned a while ago, na mas lamang dyan or mas ang weight ang mas parang lamang in terms of as our parang reference when it comes to the right dosage. Tama po na mas kapag there's a chance na may weight kami, we will really use the weight first before kapag in determining the right dosage for the medication. Tama po, ma'am.
Yes. Di ba din, kung mapansin ninyo yan, pag-actual na, makita ninyo yan, weight lang bata ka age. Di ba, naka-bracket sila? Diba, naka-bracket. Pasok din yan sa bracket. In case, kunyari 6 months ang bata, tapos ang bracket weight is 4 kilograms to 6 kilograms. 6 months ang bata, pero ang weight ng bata is beyond 60 kilograms. doon ka na sa next ang ipapalo mo. Kasi nga, always may bearing ang weight, mas mabigat ang weight ng bata over the age.
Yes po.
Okay,
Noted po.
ginagamit lang talaga natin age kung walang weight. Diba? Yung makita ninyo yung mga over-the-counter drugs ng mga paracetamol. Diba? May mga label yan what to give kung ganito ang edad ng bata. Kasi walang mga weight scale. So, ang ginapalo nila is the age. Pero nakalagay naman dyan, dalawang data, alam mo yung age ng bata, as well as alam mo yung weight ng bata, you follow the weight. Kasi in general talaga nag-base ang ating dosage ng mga medicine. Diba even in your pharma, emphasize yan, doon sa weight ng bata. Kasi pag-weight ng mga doktor, ginatak na talaga nila anong weight. Pinapapit nila yan according to age and not according to age. Pero nga again, may mga instances na wala tayong makuha na weight ng bata, ina-base na natin sa age. Okay? Another clarification on our question. Klaro ba yan ang aking lesson? Yung report nyo ha? Mag-join kayo now para ma-send ko na tomorrow at 4:30. Other question, clarification. Magtanong kayo mga preparation fees at pwede lahat mga na-discuss ko. Wala akong bigay ng fees na hindi ko na-discuss. Pwede na-discuss ko lang na rin. Pero definitely nakuha ba yan? Double party. 2M kayo, di ba?
Opo, ma'am.
Intindihan ba? Students?
Yes, ma'am.
Yes.
Ginabigay kayo muna talaga yung content na bibigay natin pag natapos ko na yung content ng exercise. Kasi kumalabas talaga yung questions pag mag-exercise or pag-actual. Diba? Dali lang, di ba? Okay. We will not live tomorrow, but instead, we will meet on Thursday together with you at 8:30. Sure, 8 a.m. talaga. Ako ba ang first class nyo? Ako ba ang first class?
Kaya lang.
Ay, oo, kasi ako lang pala whole day kasi RRA yan. So, gamit yung RRA para ready na kayo sa first call. Okay, sige, 8:30 na lang tayo on Thursday. Pag natapos natin ang Thursday, pwede tayo mag-meet ang Friday. Diba? Okay ba?
Opo, ma'am. Pero online
Okay
pa rin,
kayo, ma'am.
May mag-hilakan sa mga back to normal na talaga tayo. Klasa na nag-building. Okay? Sayangan gani. Kaya pinakong face to face. Pero may nalalang hindi pa yung face to face.
2, 3, 4.
5, 6. Akala ko ba 6 ka man natatawag. Countdown na si Pabilar.
Sorry, ma'am.
Okay. Wala nang question, clarification, may easy tayo. You can also ask question. I-message nyo lang ako kung may mga validation. Okay? So again, tomorrow quiz at 4:30. Please, pag-join naman kayo sa namin. Miss Espino, can you please read the closing prayer?
Okay po, ma'am.